The best way to explain the mental health program is to start with a bit of history. In 1983, the state of Maryland was faced with the loss of federal funding at several of its state psychiatric hospitals and centers for the treatment of developmental disabilities. And the School of Pharmacy and the State Department of Health and Mental Hygiene then formed a collaborative relationship to try and address these issues. Our aim is really to increase access to services, increase access to pharmacists in unique roles in psychiatric pharmacy, and better serve the citizens of Maryland. The School of Pharmacy, through the Mental Health Program, operates a statewide pharmacy and therapeutics committee that not only handles the formulary for all of the state's psychiatric facilities, but also addresses drug use policies, prescribing policies, medication monitoring policies, and then tries to look down the road and see what challenges we'll be facing and develop plans proactively to address those issues for the state of Maryland.
The mental health program offers a ASHP, American Society of Health System Pharmacists accredited PGY2 psychiatric pharmacy residency. This is a residency program that trains pharmacists to specifically practice in the area of psychiatric pharmacy and to eventually obtain board certification as a psychiatric pharmacist. Our residents have the opportunity to train with multiple psychiatric pharmacists and really have novel experiences because the pharmacists in our program work in substance use disorder, they work in developmental disabilities, they work in psychiatry, they work in research, and our residents go on to practice in psychiatric pharmacy and so build in the area of psychiatric pharmacy. We also have mentors available so that if students want to talk about next steps, they have individuals that they can work with to set up research projects, and just get career advice.
Our program encompasses several contracts with the state Medicaid. We also offer a statewide P&T committee for all of the state hospital systems for behavioral health here in the state. We do an abundance of training and education, not only for students, but also for residents. We also offer a diversity of clinical pharmacists and dispensing pharmacist roles throughout the state.
We've played a major role in the development of standards for the administration of injectable medications by pharmacists in the community. My hope for the future of the program is that the program continues to grow, that we're continually able to produce new psychiatric pharmacists, that we can define more roles for psychiatric pharmacists, and that we can continue to improve care and access to care for patients.